Live from Studio C. Two guys who ask, wonder what they're doing in T-Town right now. Not this. It's South Alabama's #1 podcast, Drive Time with DJ and KJ.
Good Thursday morning. Welcome to Drive Time, the best worst show ever. Good morning, Danny Smith, Kane Dickey, King Kane. Good morning, sir. Jesse James. Good morning to you. Casey Halsey, Kay Luttrell. Good morning. Miss Carroll. Good morning. There he is, Earl Crook. Good morning, sir. Still need to talk to you. Miss Harp. Good morning to you. Kimberly Peebles. Good morning. Tracy Miller. Good morning. Wendy Lucas Williamson. Good morning. Wendy Hanks, good morning. Mitch Redash, good morning to you, sir. Jennifer Taylor, good morning. Tippy, good morning, Tip. And good morning, Miss James. Good morning, Kim Wood.
Good morning, DJ. Good morning, Life Changer. Getting in with us early this morning.
Yes, ma'am. Good morning.
Hey. What's going on? Tracy Miller says, Happy Friday Eve.
I tell you what, we're about to make another one.
I tell you, man.
Thursdays. I really do. I love Thursdays. I mean, you can just make, at this point, regardless how the week's gone, you can make it. I love Thursdays.
Is it me, or does it seem like that the time seems to go by a little faster?
Pretty quick.
When you're having fun.
Yeah, I think so.
I mean, it seems like that. Well, I guess we did miss Monday, didn't we?
Yes, we were off Monday.
Yeah, maybe that's what it is. I don't know, but well, what's going on this morning? Did you go home and study up on any of the Swiss government's CDC guidelines, if you will?
I watched Grant. I watched the conclusion of Grant.
How was that?
The third of 3 nights. It was great. They've been propping this little docu-series up for, I don't know, 3 or 4 months.
Right.
And it lived up to its billing, in my opinion.
So
I loved it.
It was that good.
I loved it. It was good. I love that. I love the Civil War era stuff anyway. I mean, It's pretty interesting to me. It's hard to comprehend, war going on U.S. soil, and it was bloody. It was certainly bloody. But I enjoyed the series, enjoyed learning a little more about U.S. Grant, and it was well done.
Are you? And I'm asking because are you one that likes to go to the enactments and all that kind of stuff?
I've never done that. I wouldn't be opposed to it. I probably will. I would probably put that on my list of things to do, but I've never been to one. But yeah, I would have an interest if it worked out from a scheduling standpoint. Yeah, I would probably do that.
I've always thought that was kind of interesting. For those people that get up and do that kind of thing. It's kind of hot a lot of times when they do that stuff. They got some more thick stuff.
Oh, yeah. They were
especially when they're in the real, attire and all that stuff. Cannons and guns and what do you call them? Muskets and all that kind of stuff. Mm-hmm. So, have we got a bunch more people in join us? You want to go through? And
let me tell you kind of how we're doing this. We had gotten word during our sabbatical that not everybody likes hearing their name called. They like just to come in, watch some of the program, get out, whatnot, and that's cool. That's fine. Teach his own. So we're just saying good morning to those who say good morning when they post up in here. So it's not slighting anybody. We're just trying to accommodate the wishes of all. That's what we, here to have a good time, and people want to do it different ways. That's great. Good morning, Naomi Lindsay, Sarju Patel. Good morning, and I'd like to mention 100 pizzas free at Domino's today, starting at 4. Of course, Sarju and Wade, with their efforts through Brute and Strong, still getting it done, still doing it. Thank you for those efforts, Sarju. And 4 o'clock, Domino's Pizza here inside of Walmart, 100 free ones starting at 4 o'clock. Thank you for that. Good morning, Kimberly Dawn. Good morning to you. Cheyenne, good morning. Hot Rod's in. Good morning. Rhett Joyner. Good morning, Retro. Elizabeth Bush, good morning. Jason Ward, good morning to you, my man. And, good crowd in this morning.
So,
got 2 guests coming later.
Yeah, let's talk a little bit about that real quick.
Don't leave us at the top of the hour at 8 o'clock, 8-ish. Debbie Gist and Ashley Strawbridge are going to be back in with us. We had them here, 12 weeks ago at the onset of this COVID-19 stuff, to try to give some information that we could plan on back then. And we're going to get an up-to-date state of the COVID, so to speak.
And they're going to be moving left to right on your radio dial.
Yes, they will. Yes, they will.
I'll tell you what, man. That's one of the, I enjoy hearing that. That's that's good. Speaking of that, I'm gonna try to reach out to Dr. Mackey today, see about getting him on the phone, or if he's down this way, get him to stop by. Maybe he's decided to go to the beach and take a break.
I want to catch up with Dr. Mackey.
It'd be nice to get him in, but just to see what's going on, what's happening in the big town of B-Town, besides some rain and that kind of thing, and I guess the people out, here or there. Have you seen anybody out that looked like they were hunting the money? I
haven't, but I haven't been around the underground theater lately, so I know that's usually where it starts.
Yeah.
And it kind of fans out from there. But
speaking of that, I've got a pot splash to splash the pot with.
Can I send a shout out right before you?
Absolutely.
We're being picked up and viewed this morning in the ATL. Tom Dowdle, good friend of our family, in with us this morning. Good morning, Turbo.
Up in the ATL,
sir. The antennas.
There you go. We got that antenna turned just right, though.
You did a good job.
Got that wattage going just like it's supposed to be this morning.
Yes.
Want to thank Jesse Rigby over at James Furniture for his $200 splash.
Hated it.
No, we didn't hate it. I hit the wrong button. I need to find that splash thing. I got to get that back on here. But thank you, Jesse. He put $200 in the pot, which now brings the cash pot to $1,750. And we also had let me get that pulled up. Also had another splash from, let's see, this is Aaron Crawford with Nisa's holistic, let's see, and it's going to be a 25, let's see, it's a $100 holistic crate. And she said she was going to drop that off to you, DJ, at the dealership. And so that's another a crate full of some really nice looking stuff. $100 worth. Compliments of Miss Erin Crawford and Nisa's holistic. I can't think of the last name of that thing, but thank you for that, Erin, and we appreciate it.
Alternatives.
That's it. Come out sitting there thinking, what the world, and holistic alternatives. I got all of it in front of me, but it don't have alternatives at the end of it. So thank you for that, Aaron. Tell you this, I went over and had to have a mattress. So I went over and saw Jesse at James Brothers and looked at several mattresses. And did you know that a mattress comes now in a vacuum sealed bag in a box I'm talking about a king size, yay big, yay wide. And I'll tell you this, you'd have never got me to believe that mattress would, like, I mean, I sat on it while I was there and stuff, but I'm talking about once you get out of the bag, you're like, how's this ever going to work? Let me tell you something. Absolutely one of the best mattresses I've ever laid down on, and it was not the most expensive mattress. So,
when you get ready to open that vacuum seal package, make sure you have it where you want it.
Oh,
it comes alive.
I found that out.
Yeah,
because I didn't.
Yep.
And talking about having to manhandle something, but no. Listen, anything you need, if get over and see Jesse and the good folks over there, Barbara and Amber and everybody over there, that they'll take good care of you. And I do know that he told me yesterday, if you're looking for a freezer, he's got several freezers coming in the next few weeks. I think they have been hard to find.
I know somebody who's going to get one. Michael Sawyer.
There you
go. He was
talking
about it yesterday. I'm going to pass that along.
Yeah, he's got several coming in. Okay. And so they are, I know, they've been hard to find and hard to get. And so wanted to mention that, but thank you, Jesse. So we're getting closer to that $2,000 mark, and and that's just cash.
Just the cash.
Yeah, so $1,750 in cash, and we are getting closer to that $2,000 mark. Y'all get ready, because that's just how things seem to kind of take on another gear when that thing hits a couple grand. You ever notice that?
It does. Oh yeah.
So we appreciate that. Appreciate everybody that has splashed the pot, be it cash, be it whatever. Did we mention yesterday Tippy Wagner's splash to the pot? Did we mention that at all?
I don't have it down.
All right. Well, we need to mention that as well. Let me get that pulled up. I was going through here my notes. Tippy wants to put or has put in a $25 gift certificate for Rainbow's Sweets and Trading Post. I think that's in F Camp.
It is.
And you don't down there see Tippy. If you don't know Tippy, he is a great guy, great guy. And get on down there and see the good folks down at Rainbow's, and we appreciate that. I mean, that's got to be what, $500-$600 worth of gift certificates and things over there, $400-$500 worth.
Oh yeah, easily.
Yeah. I mean, that one of everything that Micah's got out there, it's got to be easily worth what, $200 or $300 or more.
Yeah. Mm-hmm.
Yeah. So that's we certainly appreciate that, Tippy. So it's going to be it's going to be very interesting to see what happens, and I can promise you, this weather hadn't. I've seen some people out hunting, or I said they were. They may have just been walking.
It'll ramp back up. It'll ramp up this weekend, I figure, if the weather permitting.
Yeah. So good morning, Sherry Weaver.
And you've told everybody exactly where it is.
I have told everyone, and I will tell you this: clue number 2 is forthcoming. I mean, I'm not saying it's going to happen during this show. I'm just telling you that it is forthcoming. So I would be paying attention to the Drive Time group, because that's where you're going to find them. Not in a secret group.
But a double secret group, maybe?
Well, I mean, do they make those? Not in a secret group. A private group. That's what Drive Time is. A private group. So,
but it's open to everybody.
Yeah, I mean, anybody can join. It's open. That's right. It's open to everybody. It's just
decoder rings are on the way.
Yeah, right. How'd you guess? You're gonna be able to put yours up to a mirror, or we've got some invisible ink paper coming, and you'll be able to scratch across it and see what's happening. You know. I do want to mention one thing that I do think is a sign of technology and a sign of the times. You and I talked a little bit about it last night. The Bruton City School Board having their school board meeting via Zoom, video conferencing. Mm-hmm. That's I think we're going to see a lot more of that kind of thing. And I'm not just talking about with Bruton City School. I mean, with the school board. I mean, I think that's a sign of things to come. It's a fairly easy and I'm talking about the platform, with Zoom and that kind of thing. Those types of things are fairly easy to get worked out, because you can use a phone and that kind of thing to do it, and not necessarily have to have a studio set up to do that kind of thing, So I do think it's kind of neat that we live in a time where, think about it, man. Back in the, 70s and 80s, CB radio was the craze. Mm-hmm. I mean, you pass every car, you pass that antenna hanging off of it.
We had one.
I mean, everybody did. Now technology is just so crazy. I mean, it really is just nuts. So I thought that was pretty interesting that you told me they did it that way. Did they have them all like on screen at the same time and like a block or something? Yeah, that's pretty. I
guess the question I would have with regards to that is if, and I understand the climate today hopefully will not be what it'll be 30 days from now or 60 days from now, and I'm looking forward to our medical professionals, giving us some information that may verify that or validate that.
Sure.
But if the school board is having to meet like that or choosing to meet like that, how can you go? How can you get back on campus and go to school if you can't meet as a board among 6 people? How can you put 20 in a classroom?
Per the guidelines that they have been put out, I don't know that you can put 20 in a classroom.
What I'm saying is I think it's great that they can still conduct business in these trying times.
Sure.
The technology exists, that
Sure.
we have it here. I think that's awesome. I get it. I understand it. I'm thinking 2 months from now, if they're still choosing to meet like that, but yet we're having on-campus school, to me, that would be contradicting messages.
Yeah, I mean, I can see that. So it again, I don't know if these things are going to be permanent. I do think that there'll be ways found to better make processes more efficient with these types of things. You know what I'm saying?
Yeah.
I don't necessarily know. I mean, because
I wasn't saying that to be critical.
Oh, no.
I'm just understanding.
Correct, right.
I'm just, it's, I mean, if that's the direction we're going, I guess that's the direction we're going.
Yeah. No, right. And I get that. I guess, I think that with the, virus and all the guidelines that come with it and the things that they, want you to do and that kind of thing, I still think that, I guess my question to that would be, okay, you have a meeting like that, but how do you, if you wanted to get on the agenda to speak, do you just comment?
I don't know.
I mean, is somebody monitoring the comments? And I mean, again, this could be any public group that was doing something live like this. We monitor comments live. We try to answer as many as we see and can. We're also not holding a public forum, for this and that. You know what I'm saying? So I guess my question would be, how would you go about doing that? If you had a point of business you wanted to speak about, would you get on the agenda and then they would acknowledge you by the comments that you made or something? I don't know.
Way over my skills.
Yeah,
I don't know.
Hey, listen, I'm gonna be honest with you, man. Come a long way from antennas laying in chairs.
Oh yeah. That was the day.
Hey, you stop me when I'm wrong.
That was the day.
You know what I'm saying? So, I saw that as well, Sherry. We probably put that out that they're having a town hall meeting. The school board is at the Terrell Miller Auditorium on, was that June 2nd? I believe it was Tuesday, June 2nd.
That's what the post said. Yeah.
Yes. To discuss a new policy. So, did you all see? Let's see, Jennifer Taylor, did you all see the new Ford Explorer? It heats up to 100.
Good morning, Happy.
There he is. I'm talking about, let me tell you something. We have a legend in here with us this morning. A true to life legend.
YouTube sensation.
I promise you.
Our guests are here.
Well, let me get, you want to answer the door? Let me get.
Yep.
Hey, we're not going anywhere. Just hold tight. We'll be right back.
Good morning. Now come on in. Bring some chairs over.
Y'all gonna make us look. Y'all gonna class us up. And we're gonna probably class y'all down. So we apologize. We apologize in the. There's.
You got the other chairs, Ken.
Yep. There we go.
Let me get. I'll tell you what.
Put that one right there, and then we'll get us a. I got everybody in. Maybe. Yeah, that'll do for right now. We can make that work.
That'll work.
Let me get plugged back in here.
Yeah, I might need to.
Let's see. Get my earphones plugged in where I can hear what's happening. I know what's going on. Let me get these mics turned up. Let's see here. I'm gonna probably gonna need to bring them as close to y'all as you can and get as close to them as you can to speak, because it is really directional, and I don't know how the masks are gonna affect. I shouldn't, but I just don't know. Good morning.
Good morning.
Glad to have y'all back.
Thank you.
Let's see. It's been, I think we said, has it been 3 months?
Not quite.
2.5?
Yeah.
Yeah.
Maybe.
Okay. Well, we deal in the ish anyway here, so you know what I'm saying. So 2.5 ish, 3 ish, what have you. I mean, it all kind of works out the same. So a lot has changed. Obviously, the last time that y'all were here, obviously y'all didn't have masks on. This time you are here, you do have masks on, and I'm not the best interviewer in the world, but I know that. Just yesterday, and I'm not trying to put you on the hot seat like starting out very beginning, but I guess I will somewhat. The CDC can't seem to make up their mind on what is what we need to be doing, what we don't need to be doing. And what I mean is, last week it was, we don't think you can catch it by contact, with surfaces and things. This week, they did a complete 180 reversal on that. Can you talk a little bit about that? And is it just because this thing is ever changing and so new, or is it because they're just in a rush to put information out when they, I don't know. And that's why I'm asking that question.
Well, I personally believe that it is basically because it's an evolving disease.
Sure.
It's, they are doing the research as all of this is going on, and it's to be expected that their guidelines are going to change based on what the research is showing them.
Sure. And I knew that as time goes on, I knew things would change, I guess we all did, but I just don't understand how you can go, is this virus changing so much itself that we can go from 1 week of telling everybody, hey, it's okay to, contact surfaces is not bothersome, into yes, it is. You understand what I'm saying? I mean, I don't know how we can go from that to this, because I've seen a lot of criticism of the CDC because of this, and that's why I'm not trying to harp on it. I'm just it's very worrisome that we keep getting conflicting information, if you will. And like we just said, we're, 12 weeks or 10 weeks later, 11 weeks later than when we started.
I don't know that the virus is changing that much, but it's a novel virus. It's a brand new virus. So we're just learning about it. And so as they do studies and learn more, then that's why their recommendations are just keep changing.
I got you. So have we come to the conclusion yet that hydroxychloroquine, or however you say that, is not a treatment, or it is a treatment?
I think they're still doing the studies, but from what I'm reading is, there's not enough evidence yet to support widespread.
Well, DJ, I've about said all I know to say, so I'm going to let you handle it, since you're a lot better orator than I am.
We're going to welcome back two ladies that were with us several weeks ago, Ashley Strawbridge and Debbie, is it Gist? Gist. And appreciate y'all being back with us. And I guess my first question would be, on the local front, how have we, when I say we, our medical facilities, how have we held up with the people that have come in? How is the testing going? What do we know now, and where are we at now as compared to 10 or 12 weeks ago when we had you ladies on the first time?
Well, for me in Atmore, as we've listened to the governor's orders and taken her directives, there's no visitors allowed at the hospital anymore.
Do you see that being in place for some time? Is that probably here to stay for a little while?
I would think so.
Yeah.
That's the safe thing to do, to minimize traffic through the hospital. We all are now masking in the hospital, staff, visitor, And when I say visitors, we don't allow visitors unless they're a caretaker.
Okay.
That patient. So everybody that comes through the facility is masking. We now check temps and signs and symptoms on all of our employees and anybody that comes into the facility. So, we're doing a lot more monitoring, a lot more source control, and so it's changed a lot. And testing has gotten better, where it was taking 6 or 7 days to get turnaround. We now see turnaround in 2 days with our labs, so that has gotten a lot better.
One of the concerns for a lot of us is was the thought or the possibility of our medical facilities being overrun with people who were in need and having professionals to treat or care for. And I think, fingers crossed that doesn't happen. I hope we have not seen that to this point. But if that happens, then you run into a whole other set of problems. And I think, when y'all were here the first time, we talked about in Escambia County having right at 100 beds, best case scenario, to treat people with, which is not, when you have a population base of 38,000 people, that could get eaten up fairly quickly. In terms of people who have been coming with symptoms or concerns, has it been overrun? Has it been a rush? Has it been a steady flow? Has it been within the capabilities of what we can handle?
I would say yes. For our facility, it's been within our capabilities. We've been able to manage, and I think a large part of that credit goes to the citizens of Escambia County because they've taken the recommendations seriously. It's not to say that we won't see increase in cases. We've had some, but it has not been like New York City.
Sure. One of the things that we that we talked about here, and this is just for me, if I can't see it and feel it and touch it, it's hard for me to process it. Like what goes on in New York, I can't comprehend that. I mean, it's just a sheer number thing that I can't get wrapped around. But like here in Escambia County, I know of 3 people who have tested positive, who have been to a medical facility, have had the test done, and 3 of them have tested positive. I know of personally 3. 2 of those never showed any signs of sickness. They did have the 14-day quarantine as a part of it until they took another test that tested negative. 2 of them never showed a symptom. One of the people did get a little sick. I think actually went into a medical facility for a couple of days. I don't think it ever escalated to a life-threatening thing, but there was certainly some anxiety on top of what could happen. So one of the 3 did get sick. People who are being admitted to the hospital, and I know there's things you can and can't say, is there a rhyme or a reason to how long a typical stay would be in a medical facility for people who have tested positive? Is it a 2-day sickness? Is it a 2-week sickness? Can you speak to that at all?
Well, it's not predictable. It's not. Some people are managed, they do well. They never require ventilator care. They go home, they finish their recovery at home, and other people are much sicker. And I don't think that any of us can predict why, other than people who have risk factors that do put them more at risk.
So not everybody who checks into a facility is put on a respirator necessarily?
No.
Okay.
Majority are not.
Majority are not. Okay.
And we've had very, very few that were actually admitted to the hospital. For the most part, they come in to the ER with mild symptoms. They're tested, go home, and we let them know a couple of days later that they're positive. They need to quarantine for 14 days and to isolate themselves into one room of the home. So, fortunately, most people are doing really well and have very mild symptoms.
You mentioned something a moment ago about the people in this county certainly heard the message, and I think in large numbers have adhered to the precautions and the safety measures put in place. I notice as I'm out and about, the handshake's over.
Right.
So there's no more handshaking, and you can see people. It's kind of like a school of fish. If this person moves 2 feet this way, you'll see this.
Yeah.
I mean, everybody's just kind of morphing and moving to keep that safe distance, and I think that's a credit to people, and that's certainly things that we can be vigilant at moving forward. And I think that's kind of here to stay anyway. But I guess a follow-up question to that would be, what can we do in addition? It's a fluid situation. We're finding out more about it.
Right.
Hopefully a vaccine comes about at some point in time, and that'll help as well. What can we do? Do we know anything now that we can do in addition to what we've already put into place? Is there any new information in terms of safeguards or things we can do to make our processes and our daily lives even more comfortable and safe?
I don't know that it's new information, but I mean, it is the single most important factor is your social distancing, wearing your face mask, your hand sanitizer, your washing of your hands when you have access to a sink. It's the basic things that have probably played the biggest impact on limiting the spread.
Well, correct me if I'm wrong here, but for a time, other services at the hospital had been suspended.
Yes, correct.
Non-life-threatening surgeries or medical procedures. Have those come back online yet, or are they still in a standstill waiting to see?
They have, and that was actually mandated by the governor's order that we had to suspend all of those elective procedures. For one, it limited people coming into the hospital. It helped save our resources as far as PPE and masks and that sort of thing. And she has just recently lifted that ban, and so we have started taking elective surgeries and elective x-rays and that sort of thing. So we are seeing it get a little bit more busy.
You spoke of PPE. Is that becoming more available, or are y'all still experiencing a shortage of certain things, or do you feel like as a medical facility you have the things to protect your employees with?
Fortunately, we have not experienced a severe shortage. We do have what we need to take care of our employees.
And we have had in both facilities, if there have been items that were short in one, we've shared between each other. And on top of that, we've had folks that are out beating the bushes. When we needed gowns, we've had a local company out of Atmore, Muskogee that was able to provide some disposable gowns that have been a godsend.
You know, I'll tell you something else, and you just mentioned that, and I'm glad you did. It seems like when you get into times that we are living in, that the good really comes out in people. And I think that a lot of times as a society, our best foot is put forward in times like this. And the efforts of so many individuals, it's almost endless. I mean, you don't want to start naming them because you're going to fear that you're going to leave somebody out. But, you know, one of the bigger contributions that I've seen, I don't know how the money was earmarked or if it was earmarked, but the Porch Creek Indians have made a couple of sizable donations to help in the effort. And speak a little bit to that and how much that helps our medical facilities in terms of day-to-day operation and certainly working through COVID-19.
It's been a tremendous help. I know they've helped us with some gloves, and I know the state as a whole they've given money to. But it's always great to have them as partners with us. And as a resource. And like we said, Muskogee changing over to doing hospital gowns or the isolation gowns has just been a huge help.
And that's just one of many.
Oh, sure.
There are so many
Yeah.
examples.
Yeah.
We probably
We've had, I
could
can't
speak
tell
for
you
a
how
whole
many,
hour.
I can't tell how many people around here are making masks. You know, I mean, just individual,
right.
you know, people at their homes making masks to get out to help with the effort. But when these things take place, and we're going to mention Muskogee and even the Porch Creek Indians, do you find yourselves having to reach out for them to help, or is somebody contacting the hospital and say, hey, I think we can do this. How can we be a piece of the puzzle?
Well, I know they reached out to us, but there have been others that, you know, we've initiated dialogue with too, trying to make sure that we had the supplies that we needed.
Is there, I think I know the answer to this, is there an end date to this? I mean, is this...
Not that we know.
So, I mean, we're not through this. People don't need to let down their guard and say, okay, we've made it. It's over with. The restaurants are open, yada, yada, yada. This is going to be an ongoing thing. And I keep hearing different reports and reading different things where there's a very strong concern that in the winter there could be another wave of it. I think I'm right when I've heard somebody say the warm temperatures beat it back a little bit. So maybe in this, is that true? Is that good information?
I've heard that too.
That is one thought.
Unfortunately, in the state of Alabama, we are on the increase for cases. If you go to the ADPH website and pull up their data tracker for the COVID-19, you'll see a graph that is showing more cases. We are not on a decline.
Do you think that's directly related to opening up a little bit more than we had been previously? Or do you think there's something else going on that's making those numbers jump?
I really, you know, it's it's easy to say, well, we did this and then this happened,
Yeah,
but
yeah.
we really don't know the causation. It would be something that a logical person would question.
Yeah.
And do you think it could possibly be because of the sheer number of more tests that are being done versus, previous, just say the last 2.5 months? I know when y'all were here the first time, when we spoke about testing and the number of tests available or not available, actually, do you think that, and I'm only asking that question because you see some, people put some of those numbers out and the next thing you hear is well, we are doing more testing now. So, do you think that has a correlation to do with it as well? Or is it, you think it's just that many more people coming down with it?
From at least in Montgomery, they're having a really rough time, and it does appear to be many more cases. There are hot spots throughout the state. Obviously Mobile has had some issues.
Sure.
So it's hard to separate out that factor from the factor that we do have increasing numbers as well.
Well, listen, being that y'all are two experts, and I'm going to ask this question, how close are we to getting the upper hand on this thing? I mean, I know that's a loaded question. I'm not trying to put you on the spot. I guess what I mean is, with y'all being in the circles that we're not, you can't believe everything you see on the internet for sure. You certainly can't believe everything you see on the news channel, that kind of thing. It's always slanted one way or the other, and we try to provide information that's not slanted in that way. That's the reason I asked that question. Are we getting any closer to getting some sort of a grasp on being able to put this? I'm not talking about the economy. I'm talking about the virus itself behind us.
I think there is a tremendous amount of effort around the world that is looking at ways to either develop a vaccine or develop some treatments. And, I'm optimistic that something will come from that research. But as of today in Bruton, Alabama and Atmore, Alabama, it's just not here yet.
Well, when you're meeting with Chris the next time, Chris Griffin, I would suggest to look at the Swiss model. The Swiss have done some things in terms of getting back. That's just tongue in cheek. This is the best worst show ever, and I apologize that you're having to.
I'm sorry for my part in this already. So just so y'all know.
I'm sure he's listening, so.
Yeah. Okay. Well, Chris, check out the Swiss.
If you need to figure out what that's about, check yesterday's show, and we talked about the Swiss's governmental affairs. Let's just say that.
Looking at the county, I looked at the table that you referenced when you told us the first time that was where we needed to go for good information. I think we were at 45 or 48 confirmed cases in the county.
Yes.
It seems like that we're not trajecting up as fast as other communities, other parts of the state. You mentioned a couple of the more metropolis areas, but I mean, I would think that one's too many. I get that. I'm not trivializing anybody who has had this or suffered from it, but I would think that we're doing okay. I mean, 45 is not a terrible number given where we were. I mean, we were at 20, a month and a half ago?
It has been a slow, gradual increase. I can say that. And as things open up and people start moving around, though, it's going to continue to go up because, nobody has any immunity to this unless you've had it. So it's a brand new virus, and so I expect cases to just continue to rise. Hopefully everybody stays, it stays the way it's been, and it's mostly mild cases. But I expect fully that they just continue to rise.
It's going to rise.
Yeah.
And it's things, and we talked about, things opening up, school is set to start in August or September, whenever it is. We don't know if that's been moved back. We hope to have Dr. Mackey, the state superintendent, on at some point to give us some more information. He's been kind enough to share information with us in the past. Certainly hope we can get him back on. But, if you open up school and then you have school activities, whether it's a football game or a volleyball game or whatnot, that's going to open up potentially another can of worms in terms of, people being out. So, I mean, it is a lot of moving parts there that it's just hard to figure it out. We've talked about this several times. The people making these decisions are in tough spots.
Yes, they are.
There's an economic component to this. There's certainly a health component to this. You want to do right by both, and it's just hard to navigate. And the people that are sitting in those chairs have some tough decisions to make, and it's not easy.
No. And you're not going to please everybody.
Yeah. I mean, if you go too far down this road, they're going to get some beat back over here, and I don't know. It's a mess to say the least. But we certainly appreciate all of you that are on the front lines, fighting on our behalf and trying to take care of us. And I think we can just continue to be vigilant. And mentioned the social distancing a couple of times. That's a term that's here to stay as well. We talked about the handshake being gone. Social distancing is here to stay.
So in talking about that, social distancing, let's be honest. I mean, if anything's come out of this, what I've, watched people do, and I'm a people watcher of sorts. I'm just proud to see so many people actually taking the time to wash their hands and that kind of thing. I don't know that was really going on prior to this. You know what I mean? So I think that there's always good that can come out of something. You know what I'm saying? And I think that if anything, this has made all of us much more aware of, hey, if you do something, if you grab a door handle, if you do anything, wash your hands.
Right.
I keep hand sanitizer. I mean, I don't know that my palms have ever been this white ever. And say, I mean, like, you think about it. I mean, if you get out to get gas and you punch the, keypad, you hold the gas pump. I mean, you get back in the truck, you don't want to touch the steering wheel and everything in there. So first thing you do, you slather down. You know what I mean? And whether you can get in on surfaces or not, all that kind of thing, you can never be too cautious. And
That's true.
And you mentioned a while ago, it was something that kind of caught my ear. You said the cases that have made it into the hospital, are they severe cases? I mean, I heard you say that, but I didn't know if it was. You said they were not ones with mild symptoms that didn't make it to the hospital.
Well, the ER, and then they're just discharged from the ER.
Right. And so the ones that do actually get admitted into the hospital, are you seeing? We heard a lot about ventilators and all of these types of things. Are you seeing those types of severe cases of the virus?
We have seen a couple that were severe and, might require transfer to another facility that can handle them better.
Right.
So we have seen, unfortunately, a couple of severe cases.
And all the reason I'm asking, I guess I'm trying to get a barometer or whatever, if you want, a gauge on, if you lump all of them together, where would you say it falls in as far as most people, as far as the level of the symptoms or how it affects people? I mean, is it is it more along the lines of, we see more of these people that are getting put in the hospital with severe symptoms, or is it more along the lines of people with symptoms have symptoms and they, might have cold-like or flu-like symptoms, that kind of thing? What are you seeing there?
In my experience, just for our hospital, the majority have been those that are just mildly ill. They have very mild, very vague symptoms, and they present, they're tested and sent home. But we have had a few that were serious enough to be admitted and transferred and have serious disease. Usually the people that have serious disease have underlying illness. The biggest comorbidity or underlying illness that seems to impact outcomes is cardiovascular disease. So that's a biggie. Diabetes, if you're diabetic, they seem to do worse. Yeah. So, those are the two top.
Immune compromised people.
So does the virus, what does it attack first, or do we know that? And the only reason I'm asking, some of the things you mentioned, we're talking about more respiratory type things. I mean, does it attack the lungs first? I mean, how does it, or do we know how that works?
I think they're still learning a lot about this virus, and that's why the treatment has changed so much over time. The CDC's recommendations have changed. They're just learning all the time how they need to, treat it. And some people, it is just a mild respiratory illness, and then for some people, it is a full body, like systemic type illness, so that you have organ failure, and it just progresses really rapidly.
Do you
Very
find?
sick.
I'm sorry.
I said very sick
Yeah.
to that spectrum.
Do you find, like we read and hear, do you find that the younger people tend to not be as affected by this? When I say younger, I mean, high school age and back, that kind of thing. I mean,
We've had teenagers that have been positive, but the ones that we've had have been mild.
Sure. And the reason I'm asking that is talking about the guidelines of going back to school in the fall and that kind of thing. I'm going to ask this. I'll turn it back over to DJ. You hear a lot about Dr. Fauci and some of the people on the administration or the committee or whatever you want to call it, talk about how, one day, we need to make sure that we're doing this. The next day we need to make sure we're doing that. The next day we need to make sure we're doing that. There's really no one cure-all or one thing that's going to stop. We got to just make sure that we're just as cautious as we can be and try to, just keep doing what we're doing. I would say, judging by the number of cases in other states, where does the state rank as far as, I mean, I've seen, what are we up to, like 500 something total cases, or
Yeah, I actually have your statistics.
not cases? I'm sorry,
Yes.
deaths. Yes.
Yes, we've had 581 as of yesterday, 15,775 cases as of yesterday.
Do y'all have an idea where that ranks nationally as far as, I say rank, I mean, are we in the bottom, middle, top? Where would that
Well, I don't
land?
know how it ranks when you look at all of the cases. I do know that there was some information that I heard that was looking at the past 2 weeks, which states were seeing the highest increase, and Alabama was on that list.
Last question, and this more of a Strawbridge question. In as much as alcohol establishments were deemed essential, do we have any scientific evidence that alcohol does help prevent or help keep this virus off of you? And I say Strawbridge related
I was
because
going to say, why is that a Strawbridge question?
well, he does own the publican. So I'm not talking about you. I mean David, but I'm picking back on him. But I basically I'm saying his business has been booming during this time because when you keep liquor stores open, that kind of thing. I guess where I was going with that is, do you believe, like Fauci and them have claimed, that people staying inside and not venturing out and being around people, that people's immune systems are getting weaker and weaker due to that? They've actually said some of that, and I'm like, I'm scratching my head. I know my wife's a teacher, okay, and I can tell you this: after about 2 or 3 years of being a teacher, she don't get sick. If she does, it's a rare occasion. Right. So I know you can build an immune system. Right. You know what I'm saying? I just didn't know if it's something that, like, you do read and hear, and I say Fauci, some of those people around him, have said that, the more that people stay inside, that, they think maybe the immune system might not be quite as built up as it was, with people getting outside. And I don't mean going and getting in the middle of thousands of people. I just mean you got some people just locked up in the house and they hadn't moved, which I get it if you have some of these underlying conditions and things. But outside of that, would you say it's okay for people to get out and walk and do these types of things? And, obviously, if you have to go to the grocery store and things, I mean, you need to be able to do those kind of things. You got people that they've locked down, they hadn't moved. And I'm not saying that's a bad thing. I'm just,
No, I think it's definitely okay. You need to get out. You need to exercise. It's good for your physical health, your mental health. In fact, being outside is better, if you can do activities outside, because it's open, and so you're less likely to, if you do come in contact with people, the droplets are more dispersed. So that's much better as far as transmission. But no, it's definitely okay to get out and do your walk and, just practice safe distancing and wash your hands and wear
Just
your
keep-
mask
keep
if you're
doing
going to
what
be
we're
in
doing.
close contact. Yeah.
Sure.
Keep doing what we're doing.
Another concern that a lot of us have been with our healthcare workers. How is the workforce holding up? Or is it regular shifts, or people being asked to work a shift and a half or doubles? How's the healthcare teams holding up?
Well, I think overall our teams have done a fantastic job.
Absolutely.
They have been there. They've stepped up. There have been some that have been reassigned to man our screening tents, for example, and they've stepped in to make sure that gets done consistently. So we've been very, very fortunate to have the level of staff that we have at both facilities.
And of course, that's been on the forefront of our thoughts and prayers, the people who are in the trenches at our medical facilities day in and day out, trying to keep this thing beat back. And I guess that would lead me to my second question. Are we fully staffed? Do we have enough people to provide the service that needs to be provided? Or is there a shortage? I'm not necessarily in Escambia County. Are we seeing a shortage of healthcare workers across the country?
I think in some places,
Yeah.
for sure.
Some areas like New York that was so hard hit, I think they've definitely had some issues, but fortunately for us, I can say that the staff have stepped up. If they needed to work an extra shift, they have. Been very little grumbling, so I mean, we've really had a good group of people.
Well, y'all probably have access to information or sit in on conferences or whatnot that is better than what you see on Facebook. And of course, you see story after story that contradicts each other. And I'm going to use New York as an example. We just mentioned it a couple of times. Has it been as tough in New York as some stories say? Some stories say they haven't been overrun. They've sent ventilators back. Has it been a real horror story in New York? Is that true? As far as what the information you guys have been presented with?
Well, the information that I see and that I've reviewed, it's been pretty
Okay.
devastating.
But y'all probably seen some of the reports that contradict that, like most of us do on social media, and that's one of the things that we talk about all the time. Is just where can you get good information? All we want is what is the truth, and then of course you make plans around it. I think that's what everybody wants.
Right.
But then you see so many people have these different agendas, and some of them are politically motivated one way or the other, and it's just hard to tell. But that's interesting to know that New York, so they've had a tough go of it.
Yes.
Yeah. Okay. Thank you for sharing that.
I want to ask a question. This could set off a firestorm, and I don't mean to, but I'm going to ask this question. I've just reading this. A new poll shows that only about half of Americans would get a vaccine for COVID-19 if and when it became available. What are your ideas on? I mean, is that worrisome to you? Or I mean, because you got people out there just not gonna, they don't want that kind of thing. Where does that put healthcare workers? And the public in general. I mean, if someone chooses not to, you don't know that they didn't. I mean, they're not gonna walk up and say, hey, give me your vaccination. You know what I'm saying?
Right.
They're not going to do that. Right. So, I mean, that is a little worrisome. How do you deal with that?
I think through education, you just have to, once a vaccine's available, educate the public as to the importance of it. And the more people that get vaccinated, then you start getting some herd immunity. And then the ones that don't get vaccinated, it's not quite as bad, because the ones around them have got immunity. But so through actually getting the disease or through vaccine is how we're going to get to that herd immunity.
So the same reason we don't see chicken pox anymore.
Correct.
Or polio.
Smallpox.
Yeah. That kind of thing.
Right.
We all had chicken pox when we were young. Mm-hmm. But
Is chicken pox, is it still a thing? Does anybody get chicken pox anymore?
Yeah.
It's rare,
Yeah.
but people
they
do
do.
get it. But there is a vaccine now.
Yeah.
That
If you have
Children
not
get it.
vaccinated your child, it can.
Okay.
So, we talked about, DJ and I talked about like mono. Mono was back when we were all growing up, knew people that never have a symptom, and then you knew people that had it. Like my brother put him in the bed for for months. But I don't know if there was ever a vaccine for it or not. I'm not sure, but you just don't hear about that anymore. I didn't know if that was just another one of those kind of things. How directly related is this virus? I know it's directly related, but we seem to have a handle on the flu, and I say a handle. Obviously we have deaths from the flu each year. Do you see this thing being, each year a season of this, like we have the flu season? And do you see that happening? Or, because I'm saying, if you can find a vaccine for this, why can't they find a vaccine for the flu? I know they have the flu shot, but it's a guess every year for what I understand. And y'all can elaborate on that. It's a guess at the strain or what have you.
Right.
Can we look for that as what? Is this going to be that same type of deal?
I don't know about for how long it's going to be a seasonal issue. I think for the years to come, it may be. The flu is a little different. There are so many strains of the flu, and so that's why it's so hard to pinpoint what to put in that flu shot and get it to match up exactly right.
You can't put all the strains together. Is that why they just don't blast you? Right.
Usually it's about 4, and it's just they're educated.
Prediction.
Yeah.
Right.
Prediction.
So, with that being said, if the numbers are correct, you're saying that this is going to be not a seasonal thing, but a yearly? Is this going to be something that's going to be around and all year for the next few years, as we can tell? Because we have the flu season, or so they we call that. You don't see it's not like a COVID-19 season right now, or what have you.
I have not heard that.
I haven't either.
So I know DJ mentioned this a while ago. I think the heat does or does not have an effect on this.
What I have read is that there were studies that were looking at it as far as initially the incidence within countries that had higher temperatures versus those that didn't. And I think that they were drawing some conclusions based on that, but it doesn't mean that if you live in South Florida that you're not at risk.
Sure.
And so I don't know that they've done enough research to.
Gotcha. I got you. Well, again, like I said earlier, you can't believe everything you read on the internet and everything you see and hear. Right. Well, exactly. I just, we went through at both of our stores. We went through some folks testing positive with it, and I guess when you've been through some of that, you've had that thing stuck down both the nostrils back to you, seemed like the bottom of your throat. You get a little different perspective on it. One of them actually had some symptoms. The other two didn't have any. And so that was, I don't want to say strange, but it was odd that, they all three had to obviously go for 14 days. But you see two that just, like we're all sitting here talking right now, there's nothing wrong, so do we actually know how long or when it is infectious? Is it infectious all the time? Like, if you test positive for it, does that mean you are contagious at that point, or do we know when the point of contagious, or I don't know how to say that, but do we know when you're contagious or not?
You are most contagious when you have symptoms, and so if you test positive, it is presumed that you are able to shed the virus and spread the virus. So even though you're not symptomatic, you're able to spread that virus to other people. And that's why it's so important to social distance. If you're going to be in extreme close contact, to mask, because you may be talking with somebody that has no symptoms and they're not aware that they're sick, but they're spreading it to everybody that they're, in contact with. So ADPH guidelines, Alabama Department of Public Health, say that once you test positive, you need to quarantine for 14 days. So it's thought that once you've quarantined for 14 days, if you've been fever-free for at least 3 days and your symptoms have improved, then you can, be around your family again. You can come out of quarantine at that time.
Is it like chicken pox and all that? Once you've had it, you're good? You're not going to get it again?
That's a loaded question. I don't think that they really know.
Well, I didn't know.
They've kind of assumed that you would have some immunity once you've had it, but how long that immunity lasts, they're not sure.
Right.
So studies are still ongoing, so they're not really saying for sure that you
Right.
cannot get it again.
I got you.
For hospital employees and people who enter a healthcare facility, is all the PPE, is it here to stay probably? Regardless if we get a vaccine for COVID-19 or not, like with the mask and the gloves, is that going to be normal protocol moving forward? Probably.
I don't know. It's going to depend on the recommendations if they change from the CDC and from ADPH.
How often are y'all having dialogue with those entities? Like, do y'all meet? I know y'all have local meetings probably daily, if not a couple of times a day, but how often are y'all getting information from the state and the federal resources?
There's a weekly call with the Alabama Hospital Association, and so we are on that. It was 3 times a week, and then they've recently cut back to 1 time a week. So we're in contact with them constantly. We also have contact through an online source called the Alabama Incident Management System, which all Alabama hospitals are a part of, and we report daily what our census is, how many ICU beds we have available, how many positive patients we have in the hospital, so that there is awareness at a state level, how many beds we have available. If we have a need for PPE or ventilators or anything like that, you submit it through that AIM system, and the health department is there to help you then. So that's daily contact through that online.
One of the I don't have personal knowledge of this, but some of the stories that you read, and of course you try to figure out what's legitimate, what's not, is you hear some real horror stories in nursing homes in terms of their population being very susceptible if it gets in there. And you don't know, or I don't know what is true and what's not, but I've heard some real horror stories from some of the assisted living facilities and nursing homes or whatnot. I guess I don't know where I'm going with this. I'm trying to, those people are being as vigilant as they can. They are doing all they can to keep their people safe and healthy and away from it. But in a lot of ways, I mean, there's only so much you can do, give the information that you have in terms of protecting. Have you been made aware, without naming anything specifically, have you been made aware of any facilities like that have had some real issues with it?
Yes, around the state there are.
Yeah.
So that's going on.
Yes.
It's a tough population. They're already, the majority of them are compromised in some manner. They're extremely high risk, and it's hard to control the spread in an environment like that.
So we have a question. Tracy Miller asks, with her mother-in-law living in assisted living, she keeps asking, in your opinion, y'all's opinion, do you think visiting will get back to the way it was, and will they be able to check out to leave for daily outings anytime soon?
Soon, I have my doubts. That's just my own opinion. As long as it's circulating in the community, they are at such a high risk that I would not anticipate that anytime soon.
Well, I guess the more the elderly and underlying medical condition community is the most at risk that there is.
Right.
So stay away from those people if you can. I mean, obviously family. I get that. But like you pointed out a while ago, you may have, and you may not know it.
Right.
Exactly.
Are we getting any closer to having home testing where you can,
I keep hearing about it and, reading about some things, but
okay.
not that I'm aware of personally.
me
It's just
either.
not there
Can you
yet.
speak to the difference between the nasal swab test and where they prick your finger? What is the antibodies test, or what is the difference, and what does that tell you over the other one?
You use the nasal swab, which is a PCR test. You use it to diagnose. That means acute illness. You are sick. You are shedding virus at that time.
Sure.
The blood test, which is a rapid blood test that you just prick the finger, they are much less reliable, and they would show positive further into your disease, like 5 to 7 days after you become ill. You would expect that first antibody, the IgM, to be positive. Now, if you go after you've been ill and you have an actual blood test done, they send it off to a lab and they do a different antibody test called IgG. That just tells you, have you had it in the past? So for diagnosing an actual acute illness, PCR or the nasal is like the gold standard.
Right,
That's what you're supposed to do.
So at this point, as far as y'all know, we're not any closer to having something at home to be able to test and know that kind of thing.
Not reliable. No.
Right. Do you think that? I mean, are they working on something like that? I mean, are you aware of anything like that may be?
I know they're working on the rapid testing for healthcare facilities a lot, but I have not heard of anything for the home.
I got you. I again, you read and hear stuff, so there's just so much information out here about this, and whether it's good or bad, that's what we want to do, is try to provide good information instead of what may be considered rumor, if you will. I mean, because you hear a lot of it. So I'll kick it back to DJ.
I got a question, and I hope this is a fair question. When all this started several months ago, and kind of overwhelmed us, I guess, maybe a little bit emotionally, like what could happen, worst case scenario, things of that nature. And in terms of where we are now, has it been what you thought it would be? Has it been more? Has it been maybe a little less? Has it been less because of efforts that have been put into place by everybody? Just kind of give me, if you could, your capsule on how you have processed this and what you have thought of it to this point.
I think, at least in my opinion, it has been much better than what we feared would happen initially. I think there were some steps that were taken initially to protect American citizens that have done exactly what they were intended to do, which was to flatten the curve. So I'm optimistic in that, those are measures that we have proven work in stopping or at least in slowing the spread of the pandemic.
What has it done? And I've been in on some of the planning when I was the EMA director for the county. Anytime a situation came about, you would have the situation, you would work it, and then you'd come together after the fact to have like a lessons learned type thing. What we did well, where there was some shortfalls, what we can do to maybe cover that up for future events or whatnot. And I'm just assuming that through all this and some of the meetings that you've had in place, y'all have been able to do some real good planning and think outside the box from what was considered normal 12 months ago.
Yes.
And it'll put us in better position moving. There's going to be something after COVID-19 at some point, whether hopefully it's a long time from now, but there will be another situation. Do you feel good with some of the dialogue that has taken place in those meetings in terms of getting some additional plans in place to respond if and when those things arise?
Oh, definitely.
It makes you, it makes you think differently. One of the things, and we've talked about it a couple of times, one of my greatest fears, and it could be anything, is our medical facilities being overrun anywhere, whether it's countywide, statewide, the whole country. At that point, you have chaos. And I guess my question was, I'm assuming there's been some dialogue in terms of security measures, whether it's with local law enforcement, if the National Guard, God forbid, got called up to assist in that. How cooperative have those efforts been with local law enforcement, knowing our sheriff like I do and knowing the police chiefs, I'm assuming they're all hands on deck and whatever is needed of them would be given.
Absolutely. And they always have been, whether it's been COVID-19 or, just anything else. They've always been there to support us. And then networking with other hospitals and, calling them and saying, what are you doing?
Yeah.
And seeing if they have a better way of doing it. And just trying to see, are we on the right track? Because this is all new. So I can definitely say there's been much more dialogue and collaboration with other hospitals in the area and just trying to figure it out and working together.
One of the things I always look at in times of adversity, a lot of good can come out of it. We're going to be a better medical, we're going to be better medically speaking, moving forward just because of what we've been forced to do, things we've been asked to address, things along those lines. And across the board, I think, as a society, we're going to be better. People are paying more attention to cleanliness, hygiene, social, it's just some good's going to come out of it. It's just unfortunate, you have to go through this process to get there. But I have all the confidence in the world that we're going to come out on the other side of it a better society in all aspects.
I agree.
How much? I may not even should ask this question, but I'm going to.
Oh, Lordy.
How much Xanax has been prescribed during this time, and Valium and nerve medicine?
Are you
and
talking about for us personally? Or like
I mean, for healthcare professionals that go out and put your life in somebody else's hands every single day that you do this. Let's be honest. I think the one thing at the center of all this is you're only as good and safe as the people around you, and how cautious and things that they are. And, I'm sure that there are times that you both have wanted to go home and just go in a closet and shut the door and just probably scream or whatever, So I would imagine that those type of prescriptions have went up during this time. And I don't necessarily mean with just healthcare professionals, but I mean, when you, in an unprecedented time, when a country like ours has never been faced with, you can't have church, you can't go to any sort of gathering, you're essential, you're not essential, all of these things, that has to take a toll on people's psyche, if you will. And I asked that question, kind of being funny, but I would imagine that there probably has been a lot more of that kind of thing going on just because of people not trying to drive or going crazy over this kind of thing. There are certain people in the world that are just warriors.
Yes. It's stressful. It's stressful because you're told you can't do your normal routine. You're away from your family. And just the fear of the unknown. If I get sick, am I going to be one of the ones that, ends up on a ventilator and have a severe case? So, I can see that it's definitely been more stressful for everyone.
When y'all first came in, I think y'all said that between Atmore and Bruton, there were on a great day 100 beds. At the top. Have we even seen that get close to capacity due to this?
No.
So that's a great thing.
Yes.
Yes.
Yeah. That was one of the things that DJ was talking about a while ago with, you mentioned New York, but you hear a lot about some of these states that talk about hospitals, being overrun or, not, or this or that and other. I'm just thankful to hear that we here have not been in that, case and or part of that. So that's a great thing.
Absolutely.
Because there's still people getting sick with other things.
Yes.
Outside of the virus. And speaking of that, do you, at one time, and I don't remember who said this, at one time, were they or were they not attributing most deaths to COVID-19, and then they had to come back and change some of the ways they were looking at that? And I say they, I'm talking about the CDC or whoever that putting out these numbers. there's still people get admitted to the hospital every day, nothing to do with the virus. Do you see a lot of people or do you see a lot of cases where people think they have something like that going on, but it's really some other medical condition? I mean, are you seeing a lot of that as well?
Sure. They come in with complaints and want to be tested, and they may have strep.
Okay.
Or, we've had the ones that have had the flu.
Right.
So yeah, there are times where
It is something completely different. Right. Well, that's all I got, DJ.
They've answered a lot of questions, and of course, when you come in here and you don't have an itinerary or a cheat sheet on what may be asked, that's not easy to do. But I certainly appreciate both of you coming in and giving us good information we can count on. I hope that we implement that in the way that we do things. That's what I see when I'm out. We talked about it a couple of times. That I think the people here in the Dirty 30. Of course, I may have to change also, but I think we're doing it right. Keep our fingers crossed, and I think we're doing it right, and certainly hope that a vaccine comes sooner rather than later, and certainly going to keep all of you guys in the healthcare profession in our thoughts and prayers. Y'all do an amazing job, and y'all are our heroes, and we appreciate everything that y'all do.
Thank you.
Thank you. Thank y'all for coming in again, and y'all be safe driving home.
All right. Thank you.
Yes,
Y'all have a good day. Thank you so much.
All right, we're going to reset this and be back.
We'll get everything, ladies.
We'll get handle all
Parting
of this.
gift.
Yeah.
Oh, yeah.
Yeah.
We need 'em.
Thanks.
Y'all have a good day.
Y'all too.
Thank you.
I like that smooth transition that we have going. That is top notch, man. Ashley Strawbridge and Debbie Gist coming in, giving us some more good information and holding it down on the medical fronts for us here in the Dirty 30. Appreciate them coming in and being very candid with us.
Yeah, I mean, they were the first time.
Oh, yeah.
So now let's get back to regular scheduled foolishness and shenanigans.
Yeah, I was going to bring up, and I didn't, and we've talked about the decision makers, the people who are, creating guidelines and policy for all of us, whatnot. And that's just not easy. It doesn't matter who sits in that seat at the local level, the state level, the national level. Those are tough decisions to make because so many people have an impact. And of course, with the beaches opening in recent weeks, there's been a lot of opinions on both sides of that. And one of the things that I wanted to, create some awareness on is I don't know who the sitting mayor of Pollard is. I don't know.
I don't either.
But they have not opened Bonnie Beach. And I think that is some of that cutting edge leadership. Cutting edge leadership that, will prove to be historic.
Are you sure you went to the right place?
I went to where, yes, I went to the right place.
So you're pretty positive of that.
Yeah.
Okay. Well, all I can tell you is Marcus Hall says there's a local over 50 basketball league or guys that just get together and play.
He's asking.
I'm
gonna get with him. I just messaged him.
I got you. Yeah, I mean, hey, listen, always great information from those ladies, and they, you got to commend them. They're out there on the front lines every day,
They're in the middle of it.
and doing what they do, and so we take our hats off to them for sure. I wouldn't necessarily want to work in that field at this point in time.
I think, as long as,
and I'm not saying there's anything wrong with that. I'm just saying it'd be a scary time.
we just need to continue to be vigilant, be smart, use decent sense, and just continue to work our way through this.
Yeah. And I think you made a good point. I think a lot of us, for the most part, has.
Yeah. Yeah.
You know, I'm still.
I mentioned I see it when you go out and you go to eat. I mean, you can see people making a concerted effort to keep distance.
I will say this: I'm still not thrilled about essential and non-essential. I don't like those terms, and I just think it's ridiculous to tell someone, that they got to shut their business down because they're deemed non-essential.
Yeah, I think they'll use different verbiage moving forward. I don't think there was intent there to be disrespectful. But I agree with you. It certainly came across that way.
My question is this, and you may say this is unfair, but I'm going to ask it anyway. During the middle of all this, and whatever you want to call it, crazy times that we are in, but during the middle of all this, when they shut all of the smaller mom and pop stores down, and I use mom and pop affectionately, okay, I don't mean that in a slightful way, that sold a lot of the same products that the big box stores did. Now that the government is somewhat opening back up, what do you think about shutting the big box stores down and letting the mom and pop stores be open for about 10 weeks, 12 weeks, to catch back up? Because I'm going to tell you, there are a lot of people that built businesses over their lifetime that you read every day online that have lost their business, lost everything they have.
Well, you know how I feel about it. I think it was wrong to ask them to close their doors in the beginning if others were going to be allowed to stay open. In terms of shutting down the big box store, there's no way that's going to happen. I mean, I understand what you're saying and what you're asking. No way that's going to happen. Too much economic impact there. There's just no way. There's no way.
I don't disagree with that. Yeah. I guess what I'm saying is there was a time where we said they would never ever shut a business down. Period.
Yeah.
And they shut it down.
Look, I'm on the side of it that was wrong.
I get it.
I would fight that all day long. But the number one contributor, when we're talking local, let's talk local. The number one contributor to the tax base in Bruton's Walmart, and if that shuts down, people that come in from surrounding areas to shop there are going to go somewhere else. They're not going to come to the mom and pop places to shop, and it would cripple a community.
Yeah,
it would cripple,
and it would. And I guess I'm being facetious when I ask that question. I'm with you.
I would pick up my rake and fight the fight on the first front. There's no way that one of our local stores, family-owned stores, can sell blue jeans or T-shirts and not be allowed to, and a big box store is. I mean, that's wrong. There's no way to tell me that's right.
Yeah,
there's no way to tell me that's right.
No, that was one of my big issues that I had.
There's no way that's right.
No, I think that we, as a country, we have laws in place that protect us from that kind of thing, and I'm just not sure that some of those laws weren't broken.
I don't disagree with that.
And, and there may be different opinions of that out there, but at the end of the day, I think they were. And if I ever hear essential or non-essential business ever again, it'll be too soon.
Yeah, that was a poor choice of words.
It was very poor, very poor. And I said that, if you remember the first day we came back, I said that's got to be the most poor choice of terminology they could have used for that. Because you're basically telling a guy who's, or woman or family, whatever, that's built a business all their life, that their business is squat.
I bet those, quote, non-essential businesses are required to pay taxes.
I bet they are. How much you want to bet? I saw in Nashville, Tennessee.
Now, let me say this. This goes back to the question that you had. I would like to see, and I think this would be doable, I would like to see the family-owned places get some tax relief for a time to help offset some of the loss they incurred, whether it's waiving the state tax altogether, sales tax, whatever it is. I think that's doable. I don't think that would completely right the wrong, but I think it would certainly help. And I think anything that can be done to help those businesses should be done.
Sure. Because it wasn't their fault.
It was not their fault.
This was something that happened that they had absolutely nothing to do with.
Yeah.
So, and hey, listen, we could beat that drum, forever. Let's see here.
I agree with that, Connie.
Which the stimulus fund ain't been structured to make those. Hey, I wholeheartedly agree with that. And should have been, and I just think that there should have been more thought put into the small business owner. They and look, I'm not saying that SBA didn't put out loans and those types of things. I'm not saying that. I'm saying I just think there were a lot more. I think there was a lot more that could have been done to help maintain the small business owner during that time. And I do. And hey, look, when something's new and unprecedented and people are dealing with it, I get there's going to be a learning curve.
There was no playbook for this.
There was no playbook.
There wasn't a template to go off of that we're learning as we go.
No.
And, you hope you have good people in the positions of making decisions. Here locally, I feel very comfortable with the decisions that have been made and the leadership that has been shown throughout the county. Certainly here with Yank and the city council. I mean, I just think we're doing it right. I think we've done it right from the beginning.
And before we close this out, I saw a post about it last night. The only reason I'm going to bring it up, some of the city of Bruton employees, not all, but some of them have went through a round of testing. As the post I read said that one of the employees had tested positive, and real similar situation to us, to what we went through. And I want to commend Yank for at that point in time saying, "Hey, listen," and he did what Chip did. He said, "Stop, let's stop everything. Let's get everyone that even thought about being in contact tested." And when you have leaders in place like that recognize and understand the that's the thing to do.
Absolutely. I mean, it's a delicate balance. You've got to take personal safety at the top. It's got to be at the forefront. You have got to protect your people.
Yeah.
There also has to be a town, an infrastructure to come back to when this is over
That's
with.
right.
So there has to be an economic responsibility there as well. And I've already said it 15 times this morning. I think we've done it right. Has it been perfect in every instance?
No.
But we've done it right. And I think we'll continue to do so. And I think in doing that, you will see our numbers look different than other areas. I believe that.
I wonder if we should do this. I wonder if we shouldn't have a big drive, if you will, into a try to get this worked out, maybe some tax benefits, some tax relief or what have you, and have a big push for a mom and pop weekend.
I think that'd be an outstanding idea.
You know what I'm saying?
And I think it'd be real easy to get people on board with that.
Sure.
I think that'd be real easy.
Get people out.
Yeah.
Get people in these mom and pop stores, and have a push to let's get these mom and pop stores, family owned business, whatever you want to call them. I use mom and pop affectionately to make that happen, because I can tell you it's much needed and would be much appreciated.
Well, let's frame that up and try to put something out next week of a movement or whatever we're going to do. I think that's a great idea.
I think we need to do that. And
I'm in.
And we've got enough great people and great, the Sarju Patels of the world, the Wade Winsteads, the countless people that get out and have done and put their time and efforts into things that are being done. I think there's a lot that could be done there. And I'm not saying not boycott a big box. That's not what I'm saying. What I'm saying is
Bring a little more attention.
Just have a push to shop local, the mom and pop store.
We did that 10 weeks ago.
We did.
In terms of trying to draw some awareness and push people to get out there and circulate their money locally, keep it local. And this will be the second wave of stimulus. And I think they talk about these stimulus checks coming out or whatever. This will be the second wave.
We actually did it last Thursday.
Yes, we did. Plenty of salve. Play the music. Woo! It's been a day already.
That's it.
Once again, want to thank Ashley Strawbridge and Debbie Gist. Is it Gist or Gist? I keep Gist.
I think she said Gist.
Debbie Gist, for coming in and giving us some information. Certainly appreciate all our healthcare professionals and all they do for us to keep us safe. We appreciate you being in with us this morning. If you have some time to waste tomorrow, get in here and we'll wrap the week up. Who knows what we'll talk about? Could be you.
You just never know.
Y'all have a great day. Love y'all.